Care Queen Brenda here. Many years ago, I took a course where the presenter shared something truly valuable that has really stuck with me. I do apologize for not remembering the specific conference or the presenter, but the lesson has remained pretty deeply impactful for me. He said there are two things or two questions you should ask every hospice patient. The first is, what is it you hope for? I tell my patients it doesn't need to be realistic and it can be anything. The key is that it's truly something you hope for. For some, it could be that your terminal cancer diagnosis would just go away. For others, to make it to a special date, a birthday, a wedding, anniversary. What happens when you acknowledge what it is you really want, realistic or not, you feel this sense of hope, which fills you rather than depletes you. It's okay to want things to be different than they really are. This doesn't mean I'm not going to be truthful with my patients. I am. I educate them about their disease process, how to manage symptoms, and our best guess of how much time they may have left. But I also don't hit them over the head with the hospice stick. I encourage people to lean into hope until their very last breath. My patients don't need to say to me what it is they hope for, but I do encourage them to either say it out loud to themselves or to someone they trust, or to write it down. Our minds are too much of a slippery place to just think it. Saying it out loud or writing it down gives a feeling of power to it. I go on to explain that hope is a shapeshifter. As our realities change, our hopes change. I often watch people all the time shift from wishing to a cure to hoping to make it just until their children arrive. The second thing I ask is, what is it you're the most fearful of? What is it, the thing on your skin that niggles at you? This can be harder to answer than what you hope for. Our fears are like the monster under the bed at night that we're just too afraid to face and to look at. Finding the courage to articulate and name these out loud really helps take the power from them. And I'm in awe of how helpful this can be for people. Patients often don't want to burden people and are embarrassed of what they're fearful, so they don't say. But again, when they acknowledge to themselves and even to share these scary thoughts, they all of a sudden don't have the same intense impact. I had a lady once who confided in me she was afraid to die because if she died and went to heaven, and if her husband was heaven, she was afraid to see him there because he might beat her, because he always beat her. When she finally said this out loud to me, she was able to see that it really wasn't a very realistic thought. We even had a bit of a chuckle, and I told her she was going to be just fine. And there was a real shift in her after that. Other people worry about their families and very often their pets. Patients understand what it is that when patients understand what it is they're fretting about and they share it, they find that there's an easy fix. So I encourage you to ask the hospice patient these two questions. And if it feels awkward, to say, I saw this weird woman on the YouTube video that said, I was supposed to ask you two questions. You may be surprised just how much love, healing, and connection can come from it. Please click the link below and get a copy of our booklet, The Hospice Care Plan, A Path to Comfort. It's helping families and caregivers care for the hospice patient at the bedside, and it gives safe, effective care.